What's up, y'all? My name is Tyler Boone. I am the PCF at St. Bernard's Behavioral Health. I'm just going to do a short orientation with y'all. I'm going to go over our orientation packet. I'm not going to hit everything. I'm going to hit the main points. I'm going to put it up on the screen so that way you can read it. So you can just kind of read it on your own, and I'll just hit the high points for you. So first off, while you're here, there's going to be 3 units that you might be on. The first one is APU1, the second one is APU2, and the last one is GPU. APU1 has 34 beds. It is our typically it's typically for suicidal, homicidal, depressed, anxious, med management, sometimes detox. Our cooperative patients. There's 18 male beds, 16 female beds in that unit. APU2 is our high acuity unit. It's usually for psychotic, violent, disruptive, just things like that. It holds 14 beds, 8 male, 6 female. And then we have our geriatric unit. It's our 14 bed, basically our little nursing home back there. It's our cute little old people. So the dress code while you're here, just wear what is appropriate for your school. I'm pretty sure it's just scrubs, and your student ID. The only thing that we ask that you not wear is like a badge reel. It's one of them that can like pull out and everything, just because it can be used as a weapon. So now, what you'll do while you're here, sometimes you might be asked to make beds, feed patients, assist with hygiene, provide scrubs, do vital signs, stuff like that. Mostly you'll be talking to your patients. If you're on APU, you'll be able to go to the cafeteria and the groups and activities with them. So, I mean, you can play games and cards, and I mean, they have a little basketball hoop and ping pong and activities. And if a patient wants to play with you all, you are more than welcome to do that. We fully support it. Um, so, I mean, it's pretty nice. You can sit in the day room and just talk to them and everything. It doesn't take a lot. They just want to be heard, and they'll really enjoy having someone like you guys around that they're not used to seeing every day. Personal belongings, if you don't need it, don't bring it inside. That's just the safest thing to say. Um, if you have things that we don't need on the unit, we do have lockers up front, or you can put it in the break room. Either way. No, but I just wouldn't bring anything to the unit that you're not actually going to need while you're here. If you lose something, please report it. Even if it's like the cap for your ink pen, please let us know. That's not for you to like be in trouble or anything like that. That's just because it can be used as a weapon. So we probably need to find it um, as soon as we can. Obviously, you know, at HIPAA, I'm not going to go over that very much. Social media, just don't post anything on social media that happens here. Some days there will be some pretty exciting things that go on. You might see some people, you know, who knows. Obviously, just don't mention that outside of here. This is just like any other hospital. Their privacy is protected. They don't want people knowing that they're here in this facility. Video surveillance. We have 96 cameras that are being monitored all the time, 24 hours a day, by our staff. This is in patient rooms, the offices, group room, cafeteria, all the hallways, things like that. Like there's none obviously in the bathrooms or anything, but if you're on the unit in a patient room or in an open area, you are on camera. That's just for the safety of our patients so we can better monitor them if there's not a specific staff member around them. Locked doors. This is a lockdown unit. All of our doors stay locked at all times. They don't go off the unit without our permission and unless we're with them. So when you're leaving the unit, never hold a door open. I mean, if your students are coming in right behind you and everything, like your classmates, whatever, you can hold the door open for them just for like a little bit, but don't hold it open for any extended period of time. Or if there's a patient close to the door, I would just go ahead and shut it. Um, if there's a patient close to the door, you need to look through the glass panel, make sure that there isn't. If there is one, though, I probably would just wait to open the door until they're away from the door. They will sometimes try to run out. Um, we don't want any of y'all getting ran over or something by someone trying to get out the door. So if you see someone, just wait outside that door. It'll be fine, and we'll escort them away. Make sure the door is closed behind you. Sometimes with the airflow in here, the magnets don't catch, so they don't close. So just make sure when you go through a door that it shuts behind you. And don't be alone with the patient behind a closed door. You can talk to them in their room if you want. If you have a classmate, that's fine. We prefer you not go there alone, though, just to be safe, even if it's a calm, cooperative patient. Um, just for your own safety, just to do their interviews in the day room or the hallway, anything like that. Code green. That is our psychiatric emergency. That is our most common cold that you'll have here. Um, we don't want you guys helping with that because we do this every day, so we're trained in this. And we don't want y'all to get hurt. If anything during a code, what you can do is just get the patients out of the area. If it happens in the day room or the hallway, we might just ask that you get the other patients out of the day room or that you keep patients distracted while it's going on. We don't want to cause anyone to have a panic attack or something because sometimes that does get rowdy, and we don't want it to have a negative effect on all of the other patients that are on the unit. Um, we use TACT here. It's therapeutic alternatives and crisis training, and that's how we might escort patients to seclusion, escort them to the ground, or possibly give them an injection. So just kind of let us do our thing and just try to remove patients from the area if needed. The suicide precautions here, we have three different ones. We have SP2, SP1, and 911. You'll see these on the board. SP2 is our typical precaution that most patients come in on. This just means that they have the random 15-minute checks throughout the day, and they don't have an extra precaution on them. SP1 means they have to be in line of sight by a staff member at all times. So, I mean, we can sit outside the room. We just have to have eyes on them 24 hours a day until they are moved to SP2. And then 911 or one-on-one is when we have to be within arm's reach of a patient at all times. This includes when they're in their bathroom, when they're showering, when they're in group, whatever it is, there has to be a staff member there with them at all times. This is typically for someone who has verbalized a plan to hurt themselves in the facility, or maybe they're a fall risk on the geriatric unit. So we'll just pay attention to those, and we'll also like kind of let you know before you get patients who's on what. Most people are on SP2. Elopement, as I kind of went over earlier with the locked doors, some patients are actively trying to escape basically at all times. That's not an everyday thing, but it's a safe bet just to treat it like it is. It's a lockdown facility, so they can't leave the unit. So if you see anyone who's hovering the doors and acting like they might be trying to get out, just let one of us know just to make sure we are aware that's happening too. A code R or a code ROAM, depending on what they want to call it, is when a patient does make it off the unit. So if this happens, we just call a code R on the walkie-talkies, and we just tell them, hey, this patient is code R hallway by activities, and we'll get staff there to get them back on the unit where they should be. If they run out during admission, out the gate when the ambulance gets here, we don't chase them. That's a safety risk. We just keep more eyes on them for as long as we can, and we call the police. The police will go get them, and they'll bring them back to us. These other codes are basically the same as most other hospitals. Basically here, code green is going to be the most common one that is used. Contraband, I'm not going to go over this whole list. Basically anything here can be contraband. Patients can have their socks, their underwear, money, books, and now they can have some shoes that are don't have any metal, they're not solid, and no shoestrings. So just look over this list. All of this is contraband. If you see any of it, let us know. They'll have some of this in the activities room. So like I know glue is on here, and they'll have that down there. But on the unit, they shouldn't have anything like this. So just look over that. Like I said, it's a safe bet just to say basically anything that's not underclothes or a book or money probably can't have it. Workplace violence. So while you're here, please listen to how the staff talks to the patients. Therapeutic communication is most of this job. If there is any staff member that is mistreating you, other staff, or patients, I want you to come let me know. I'll be here while y'all are here. This will stay between me and you. They're not going to know that you said anything. We just don't need staff who are going to mistreat our patients. So just kind of keep your eyes open to that, and just let me know. We don't want anyone who's going to have a negative effect on these patients here. Trust your feelings. If you think a patient is getting agitated, especially if it's someone you're talking to, please come let us know. You can almost always see the warning signs of agitation before they happen. So if you see someone walking the hallways, like just pacing around, fist clenched, maybe punching the air in their room, doing a lot of push-ups, those are typically early warning signs. So we can usually try to go talk to them, de-escalate, or maybe offer them something for anxiety, something to calm them down so it doesn't get to a point where it ends up in seclusion or with an injection. Stay calm, think before you act. That's going to be anywhere you go in nursing, but also here. And then lastly, if you see any of these things, just let us know. Outbursts, if a patient is becoming increasingly like obsessed with you or kind of um, making you uncomfortable, let us know. We don't want you to be with a patient who's going to do that. You're not here to feel uncomfortable. You're here to help these people. You're here to learn. We will always switch you patients if there's someone who's making any type of remarks to you that don't need to be said. But if you notice any of these 6 things, just come let us know and we'll get this taken care of. The last 2 pages are just pages for you to sign. Your instructors will handle that. But if you have any questions, just ask your instructors. They know how to get a hold of me, and we can figure it out. That's about it, though. Just read over the rest of the packet yourself. I'll see y'all when you are here.